a trip to the doctor, a job interview, buying groceries. For most people, these are ordinary parts of life, but for many transgender and gender diverse Queenslanders, they can be moments of anxiety or exclusion. Our research, in partnership with the Queensland Human Rights Commission, set out to understand why and how we can fix it.
So what is the education program? The Queensland Human Rights Commission provides training on human rights and anti-discrimination laws. They offer in-person or virtual sessions for teams or organisations, self-paced online modules, and public webinars. Overall, this training helps people and organisations understand their rights and responsibilities under Queensland law.
Even though Queensland Anti-Discrimination Act legally protects people from unfair treatment, many transgender and gender diverse Queenslanders still experience barriers when accessing basic goods and services. Things that most people take for granted. These barriers can appear in small everyday ways like misgendering, calling someone their name, or a lack of understanding that makes people might feel out of places.
Our study set out to look deeper into what happens in people's lives. Therefore, in this research, we will ask three key questions. First, what kinds of discrimination do trans people experience in their daily interactions? Second, what barriers prevent equal and respectful access to services like healthcare, retail, and employment? And third, how can education programs be improved to make these environments truly inclusive, not just in policy, but in practice?
We used a mixed methods approach, an online survey completed by 50 participants, and follow-up interviews with transgender and gender diverse people across Queensland. Every participant was over 18, gave informed consent, and could withdraw at any time. Thematic coding helped us identify patterns across healthcare, retail, employment, housing, and education.
Most respondents were aged 18 to 24 for 42%, followed by 25 to 34 for 30%. In terms of gender, 36% identified as non-binary, 30% as female, and 27% as male. We used semi-structured interviews to explore lived experiences in healthcare, retail, employment, and housing. Participants described subtle but harmful discrimination, like misgendering, dead-naming, or being denied gendered spaces. Even unintentional acts cause emotional distress and avoidance of services.
Healthcare was the most affected area. 77% of participants experienced at least one negative encounter. Issues occurred across multiple settings, most commonly in general practice, 55%, and pharmacies, 45%, followed by emergency departments, 30%, specialists, 25%, and other services like physiotherapy or mental health clinics, 15%. One participant told us, "There have been times I've sought medical treatment for things completely unrelated to my transness and have lied about my sex to avoid any possible discomfort." Another said, "Every time I see a new health professional, I don't know if it's safe to disclose."
The second area is retail. Followed closely, retail is another major area where participants faced frequent and visible forms of discrimination, with 62% reporting negative experiences while shopping. The most common locations were clothing stores at 63%, followed by grocery stores at 44%, and beauty stores also at 44%. Although these shops and services may appear as everyday spaces, participants described them as emotionally charged environments where their gender expression was constantly scrutinised. Many participants said that gendered spaces, like changing rooms, were uncomfortable or unsafe. One participant said, "I was refused entry to a changing room because I looked like a guy. I haven't gone there since." Small, practical changes such as gender-neutral fitting rooms or inclusive signage were seen as simple ways to create safety. These findings highlight that discrimination in retail often comes from outdated gender rules rather than direct hate. Making small changes, like offering unisex changing rooms or offering inclusive signage, can make these spaces feel safer for everyone.
Third area is employment. Discrimination in employment was reported by 42% of participants, showing that the ongoing barriers of transgenders and gender diverse people have faced in the workforce. The jobs application stage had the highest discrimination at 64%, with reports of bias, misgendering, and assumptions based on their appearance. Some felt might be pressured to prove their competence or conformance to gender norms. Fewer but notable cases occurred during onboarding, 27%, employment, 27%, and even terminations at 9%, showing that bias can persist throughout all stages of work. One participant described that their situation at a government workplace, "I work for the government, where another trans person worked, and we would constantly be confused despite not looking anything alike." This example reflects that the issues of tokenisms, where workplace may hire transgender employees to appear diverse but do not provide meaningful support or understanding of their individual identities. Participants also highlight systematic gaps, such as a lack of staff training, outdated internal system that also failed to reflect correct names and pronouns, and limited accountability for managers or teams to engage in exclusionary behaviors.
From the findings, we have developed 4 key recommendations for the Queensland Human Rights Commission education and training programs. 1. Provide mandatory inclusivity training. Service providers should deliver cultural safety and inclusivity training designed or co-delivered with people who have lived experience of discrimination. This promotes empathy and understanding, reducing stress for trans and gender diverse individuals. 2. Display visual indicators of inclusion. Symbols like trans flags or affirming statements signal that spaces are safe and welcoming, helping to reduce anxiety when accessing services. 3. Adopt inclusive record keeping. Allow optional fields for chosen names, pronouns, and gender identity in administrative systems to ensure equitable access and reduce forced disclosure. 4. Publicize commitment to inclusivity. Organizations should clearly communicate policies on safety, accountability, and inclusion to build trust, increase transparency, and provide a benchmark for monitoring compliance.
Discrimination isn't always loud. Sometimes it's hidden in systems, paperwork, or everyday habits. But small actions can make big difference. Inclusive spaces, respectful language, visible supports, these things all matter. We thank every participant who shared their stories and the Queensland Human Rights Commission for helping us turn those stories into actions. Together we can build a Queensland where inclusion isn't exceptional, it's expected. Thank you.